Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
What are the most common injuries you see in high school athletes playing fall sports?
Well, we're seeing different types of injuries. Some injuries relate to being prepared for the season, and some are more traumatic injuries. So the ones related to being prepared are with the fall. Some people don't do a lot of work in the summertime, and so they come in a little bit out of shape and a little bit weak. So that's something that we might see as stress fracture, stress reactions. And as far as other injuries to knees and shoulders with the traumatic injuries, ACL tears, meniscus tears in the knee, shoulder dislocations, those are the type of injuries we see. Some of the injuries that we've talked about with knee injuries and shoulder injuries, unfortunately there's not a lot of way to prepare for that or to avoid it. For knee injuries, the best thing that can be done is just strength and balance training before the season or during the season. Some schools have athletic trainers that can work with that. As far as shoulder injuries, just having strong shoulder musculature can help absorb some of the contact hits and help protect the shoulder. But unfortunately, no matter how much you prepare, sometimes injuries still occur.
Is rehab time set in stone, or is it a case-by-case basis?
Some of it's written in stone, some of it's case by case. If people have surgery, and post-surgical rehabilitation is more of a set in stone thing lots of times, but there is always a little variability. With injuries that don't require surgery, there's definitely a case-by-case situation on how people are recovering, different time frames, how their body reacts.
What can coaches, trainers, and parents look for to see if their son or daughter is injured?
Most kids don't want to miss time from their sport, games especially, so they might tend to try to hide things because they're afraid that they'll be taken out of the competition. The coaches and trainers and parents especially see their kids and see their students and athletes every day, much more often than the doctor does. And so it's easier for them to see changes in behavior or changes in performance, how they're performing in the competition, whether they're limping a little bit or favoring a joint. Those are things that when you see a kid daily, you can pick those things up.
What are some signs of a joint injury?
Definite signs for any joint swelling or deformity. For leg problems, if the person limps or has problem bearing weight or can't run, those are definite red flags that should be evaluated by a healthcare professional.
How has the attitude towards injuries changed?
I think there's been a definite change in behavior with schools and administrations and athletic directors in terms of appreciating the injury and the severity of injury and trying not to rush players back, and to get appropriate treatment before trying to push the players to do something that might cause more problems.
How dangerous is it when you suffer a re-injury as a result of coming back too soon?
Well, if you try to get back too soon and you haven't done enough rehabilitation, you might not be strong enough and have good enough balance with your musculature to absorb the physical demands of your sport. When you get injured, your body naturally has to recover from the injury, and you get usually weak in your musculature, and that takes time and effort with rehabilitation. So if you try to get back too soon, you might not be ready for the intense competition and speed of the sports. If you try to get back too soon and you're not physically prepared, you definitely risk a further, possibly more complex injury that may have gone from a non-surgical treatment to a surgical type injury.